Hi everyone, my name is Jamie Curtis, and I'll be the moderator for this debate today. Additionally, I'll be acting as the fielder and answering a few questions at the end of our discussion. Today we'll be talking about the differences and similarities between applied behavior analysis and positive-based school-wide intervention. So let me just make some introductions really fast. This is Julia Silva. This is Sarah Van Pelt, and they will be presenting and debating on the similarities between ABA and positive school-wide intervention. This is Mariela Escobar, and this is Ashley Gerardo, and they will be discussing the differences between ABA and positive school-based intervention. So first of all, we'll start off with Julie, and she'll give us just a little bit of introduction into this debate.
Hi, my name is Julie Silva, and I will be the stater for the pro side. I will introduce school-wide positive behavior support, also known as SWPBIS. You will hear me say PBS for short during our presentation. Looking to history, PBS emerged from the controversy surrounding the use of aversive consequences with people with developmental disabilities. Authors have cited in various articles that indicate that this type of broad-based movement was emerged in support of non-aversive behavior management during the 1980s. By 1987 to 1992, the U.S. Department of Education National Institute of Disability and Rehabilitation Research helped with the development of PBS. They granted about $670,000 for a rehabilitation research and training center on community reference technologies for non-aversive behavior management. This was a turning point for individuals with developmental disabilities. So we're gonna ask, like, what exactly is PBS? So starting from 1990, Horner et al. Stated that it encompassed many distinctive elements, such as emphasis on lifestyle change, functional analysis, multi-component interventions, manipulation of ecological and setting events, antecedent manipulations, teaching adaptive behavior, building environmental with effective consequences, minimizing the use of punishers, distinguishing emergency procedures from proactive programming, and social validation, with the special role for preserving the factors shed light on what PBS was in the early stages of PBS. More recently, in 2000, Horner further typified PBS as an approach that blends values about the rights of people with disabilities with a practical science about how learning and behavior change occur. In alignment with Horner's ideas, in 2002, Carr et al. Described PBS as an applied science that uses educational methods to expand an individual's behavior repertoire and systems change methods to redesign an individual's living environment to first enhance the individual's quality of life and second, to minimize his or her problem behavior. Lastly, in 2003, Warren et al. Also stated that PBS is intended to enhance quality of life and minimize or prevent problem behavior through the rational integration of valued outcomes, behavioral and biomedical science, empirical supported procedures, and systems change. Positive behavior support in a school is implemented at 3 levels: universal support, targeted support, and individual support. PBS is a comprehensive system of support that is in place in all areas of a school. For example, hallways, classrooms, cafeterias, the schoolyard. The goals of PBS are to prevent the development of the problem behavior, to decrease or eliminate currently occurring discipline problems, and to increase positive social behavior of all students. Now I would turn your attention to Mariela, who will be the stater for the con side.
Hello, my name is Mariela, and I will be discussing applied behavior analysis. ABA is a science in which tactics derive from the principles of behavior and are applied systematically to improve social significant behavior to a meaningful degree and to demonstrate an experimentality that the procedures employed were responsible for the improvement in behavior. The process of ABA is systematic. The individuals are analyzed to assess the problem behaviors. Behavior is identified and intervention methods are implemented to modify the behavior. In the process of interventions, the behavior instructors provides reinforcement to prompt and maintain the desired behavior. Applied behavioral analysis has been used as a method of behavioral therapy since the 1960s to benefit individuals with developmental disabilities, such as children with autism. ABA is based on research. ABA principles reflect the current research. ABA is a discipline of the field of behavioral analysis. ABA analysis is not only a form of behavioral therapy. Applied behavioral analysis involves an integration of research and application, including an intensive body of research. Research studies must be applied, behavioral, and analytical. In addition, it should be technological, conceptual, systematically, and effective. As stated in the BACB Code 1.1, behavior analysts rely on professional knowledge based on science and behavior analysis when making scientific or professional judgments. ABA can be implemented in different settings, such as in home, natural, school, community, and clinic settings. ABA professionals. Professionals in the field of applied behavioral analysis undergo to intensive training and preparation. ABA has a multi-tier approach to intervention in which professionals are formally trained and certified. The behavior analyst has education at a master level and bears the responsibility of creating appropriate treatment plans. The behavior analyst certification is considered the standard center. The BACB mandates that certified behavior analysts hold a master's degree. Behavior analysts are required to have 270 hours of core curriculum and 1,500 hours of supervised work experience. Behavioral analysts are required to pass the National Certified Exam to qualify for the Board Certified Behavioral Analyst BCBA credential. Behavioral analysts provide guidance, assistance, and monitor to those who lack such expertise, such as direct staff, parents, caregivers. Professionals in the field of ABA has high standards and encourage of ethical and professional for teaching new skills and addressing specific problem behaviors. Any model following ABA principles should follow ABA professional standards and incorporate the decade of research in behavior analysis. The 7 dimensions. The 7 dimensions of applied behavior analysis were introduced by Bear, Wolf, and Risley in the article Some Current Dimensions of Applied Behavior Analysis in 1968. The 7 dimensions describe the fundamental characteristics of good intervention. Treatments that do not follow all 7 dimensions are incomplete and potentially compromise its effectiveness. Does any treatment should follow the 7 dimensions, which is apply. Apply interventions deal with problems of demonstrate social importance. They also should be behavioral. Apply interventions deal with measurable behaviors or reports if they can be validated. Treatment should also be analytic. Apply interventions require an object to demonstrate that the procedures cause the effect. It also should be technological. Apply interventions are described well enough that they can be implemented by anyone with training and resources. The treatments also should be contextual systems. Apply interventions arise from a specific identifiable hierarchical base rather than being a set of package of tricks. The inner intervention should also be effective. Apply interventions procedures strong socially important effects. And lastly, they should be generality. Apply interventions are designed from the outset of operates in a new environment and continue after the formal treatments have ended. Now we're going to move to Sarah.
Hi there, my name is Sarah Van Pelt. While we're on the topic of the 7 dimensions of ABA, I'd like to bring up the article written by Anderson and Kincaid, which discuss how SWPBIS put significant effort into following the 7 dimensions of ABA, which was developed by Bayer, Wolf, and Risley. I'm going to go over how SWPBS does this in order to set a foundation for our debate. Applied. SWPBS follows the dimension of being applied by assisting in the reduction of problematic behavior and supporting the increase of positive social behavior of students. It is also applied at different levels, ranging from school, district, and even state level. For the behavior dimension, behavior targets are observable, and SWPBS demonstrates that the targeted behavior itself is being changed by using discipline referrals, which provide written record of behaviors. SWPBS demonstrates the dimension of analysis by observing behavior that is measurable and creating generalized intervention plans that demonstrate how to make specific changes to entire school systems. The conceptual link between the philosophy of behavior analysis is that SWPBS emphasizes data-based assessment and decision-making. Interventions are ideographically implemented, and intervention components are derived directly from research in the field of behavior analysis. As with ABA, it is necessary to show that it's the intervention that is creating the change. Most studies that support SWPBS use an A-B design to evaluate its effects. Technological. In the case of SWPBS, technological precision relates to the extent to which implementers strive for precision in individual schools. Implementation procedures are broken down into a written and visual format that encourages a clear understanding. Effective. SWPBS is an application or a theory and practice of behavior analysis to a system-level analysis and change. It is applied in a way such that it will be durable and maintained over time. Empirical demonstrations of the efficacy of SWPBS are growing. Generality. SWPBS focuses on increasing the quality of life of students and on increasing wanted, socially significant behaviors across many settings. Therefore, SWPBS does meet the requirements of generality. And next will be Ashley.
So as stated previously, there is a general argument that SWPBIS is loosely scientific. ABA is the scientific approach to behavior change. In an article by Johnston, Fox, Jacobson, Green, and Mullick, they quoted Horner saying there is no specific technique or procedure that distinguishes the approach of SWPBIS. There are different proponents offering varying procedural recommendation within SWPBIS and different theories of behavior in its support. In saying this, there is no specific technique or procedure that distinguishes the approach.
In a 2002 article written by Sugai and Horner, they state that because the roots of PBS are in applied experimental analysis of behavior, the evidence for PBS at this time is primarily derived from single subject designs. The research, while not in traditional empirical mode, is nevertheless rigorous, generalizable, and strong in social validity. Now, we go further into 2007, and an article by Cohen, Kincaid, and Childs. They agree with a statement made by Horner by saying preliminary outcomes, such as office discipline referrals and suspensions, indicate the effectiveness of SWPBS in decreasing school-wide behavior problems and creating a positive school climate. Although the results of a majority of the program evaluations yielded significant findings, there has been a lack of measurement of fidelity, possibly due to the absence of expedient, effective assessment tools. Therefore, the purpose of their study was to discuss the school-wide benchmarks of quality, a tool intended to measure the implementation of SWPBS. Descriptive data on the instrument, including internal consistency, test-retest reliability, inter-rater reliability, and concurrent validity, were collected and analyzed. Results indicate that the BOQ for SWPBIS is a reliable, valid, efficient, and useful instrument for measuring the fidelity and implementation of the primary or universal level of PBS application in individual schools. So, although it is agreed that SWPBIS is lacking in scientific validity, this tool demonstrates that there are ways to rectify this issue.
So when we actually look at the implementation of PBIS, we are looking at a blanket intervention at the Tier 1 and Tier 2 levels. When we refer back to the Behavior Analyst Certification Board Code of Ethics, it is our responsibility to provide assessment in order to provide appropriate interventions. Within SWPBIS, it is often based on a needs assessment or other indirect assessment to establish need.
Although there is often no direct or standardized assessment in SWPBIS, there is data that is collected and analyzed on an ongoing basis in schools using SWPBIS effectively and with fidelity. According to the Center on PBIS, data is an integral part to inform decision-making in SWPBIS. The use of data to support continuing an intervention or to discontinue is something that is consistent between ABA and SWPBIS.
Continuing to reference the Behavior Analyst Certification Board Code of Ethics, it is the right of our clients to be involved in the planning of their treatment and consent to the behavior change program. A child in the school setting will simply be placed into the school-wide or Tier 1 systems and given no real choice in the matter. I'd like to direct everyone's attention to the 3-tier system graphic that better explains RTI and its relation to school-wide positive behavior supports. At Tier 1 and Tier 2 is where about 90 to 95% of students will fall. And this is what's called universal or Tier 1 and targeted or Tier 2. In these 2 tiers, there is not much individualization for students. In order for students to reach a level where there is individualization, they are typically exhibiting severe behavior or are on their way to receiving special education services. Tier 3 is your remaining 5 to 10% of students in your schools. In addition, many of the PBIS systems are marketed as a package system. An example of this is Principals 100 Club. It is an intervention that's taught to teachers in a professional development training, while those that are providing behavior analytics services to clients have studied the science and are being supervised by a board-certified individual. The Center for PBIS states on its website that they do not support commercial products related to SWPBIS. However, that does not stop the retail of these programs.
Well, in the Horner, Sugai, and Lewis article, they state that PBIS is not a packaged curriculum, but an approach that defines core elements that can be achieved through a variety of strategies. The core elements at each of the 3 tiers in the prevention model are defined in this table. Obviously, SWPBIS isn't individualized like applied behavior analysis is. That's why it's called school-wide positive behavior support. However, in an attempt to create a more productive and happy classroom environment, SWPBIS establishes these elements as targets, goals brought to the classroom, which are derived from the science of ABA and have been shown to be effective. That can appear to be a packaged curriculum, but there are many ways to implement these elements, and this happens on a case-by-case, quote, unquote, individualized basis. And here's Jamie.
All right, we'd like to thank all of the members of our team for this great discussion tonight. So at this time, I'd like to act as our fielder and answer a few questions for you. So the first question that we received is, are PBIS and individual intervention plans for student behavior mutually exclusive? And do they need to be? Or do they need to be? So we feel that the way that an intervention plan is implemented really depends on the student or the groups of students that it's being implemented with. We recognize that every individual is unique and that some individuals require extensive and detailed procedures to deal with their behaviors. In these cases, it's sometimes possible to implement aspects of these individualized plans school-wide, but when they're implemented school-wide, they often need to be more broad. So we believe that plans can be exclusive, but they don't have to be. Our second question is, if you had to give a short elevator speech of how ABA and PBIS are connected to a school administrator you're trying to convince on the merits of ABA and PBIS for their school site, what would that sound like? So I feel that both ABA and PBIS have been effective in reducing problem behaviors in the school environment. While PBA is more individualized, PBIS use some of the same principles as we discussed earlier and just applies them more generally to more individuals. Both PBIS and ABA focus on positive interventions to change behaviors instead of ineffective punishments such as yelling or sending students to the principal's office. So both of these both of these PBIS and ABA are much more effective than a lot of the procedures generally used. Well, that concludes our debate for this evening. We'd like to thank you so much for listening, and we'll just display our references for you really fast. Thanks so much for watching, and have a good night.